Chapman syndrome. And any condition that decreases the space in the tunnel, either inside the tunnel or from the outside the tunnel, it leads to the compression of the median nerve, and like lunate dislocation, radius fracture, sustained flexion extension posture, fluid retention, synovitis, like this. There's very long list. Before we are diagnosing or stamping, this is the carpal tunnel. We have to rule out all these conditions.
Briefly describe that differential diagnosis.
There are causes of. Actually, these are causes of the carpal tunnel, sir. Because we have to think about this before. Actually, carpal tunnel treatment is the release of the carpal tunnel. So before going to release, we have to see all this, any condition is there or not.
Which are the common ones here?
Common, sir, like this one, plexus injury, sir.
Yes.
It's called double cuss syndrome. In the disc collapse between C5 and C6 is a very common problem. This patient come with the disc compression at the C5 and C6, and the carpal tunnel presentation is the same. So before going for release, if we release the carpal tunnel, in that case the symptom will not improve, because the problem is not in this, problem is in the neck. So symptom will not improve that case. And the symptoms: pain, paresthesia, numbness in the median nerve distribution distal to the wrist, and nocturnal paresthesia, common complaint. Clumsiness and decreased prehensions, tip to tip opposition of the tips of the thumb and little finger, and sustained wrist flexion rings on. And this actually is going in different stages, and that depends on the symptoms, how the symptoms is. Actually it depends on the compression, how the compression is going on. There is not a sudden compression, but it is a gradual process. So initially the patient had only some discomfort in the hand, but there is no any neurological symptoms is there. And as the compression is going on, patient will develop atrophy, paresthesia, atrophy of the thinner muscle, everything, and sensory loss. And treatment of the CTS. Yeah,
why there is night pain in CTS?
So
Usually
in night,
symptoms are more in the night.
in night, sir, there is a fluid retention in the carpal tunnel, sir. Due to that one, the compression is increased in the night time, and the daytime actually due to the movement, the fluid escapes out from that tunnel. So that's why the pain is more in the night time.
Even hypothyroid,
Yes, sir.
hypothyroid is presented with carpal tunnel.
Yes, sir.
Yes.
Yes, sir. And eliminate risk factors such as, actually, sir, I am not including whole things, sir, because very short presentation, so I am going only particular points. Eliminate risk factors such as takes frequent rest and decreases vibration and prolonged pressure over the wrist joint, neutral wrist splinting, neural mobilization, and check for double cross syndrome. This is very important before going for releasing the carpal tunnel. And analgesic, then surgical release with the failure of the conservative treatment. And D-curve disease. D-curve disease is the swelling around the sensor tendon. First